Shatru Buddhi Vinashaya Deepa Jyotir Namostute.
जिंदगी के दर्द को हम बांटेंगे
Department of Palliative Medicine at GCRI strengthened the implementation of the National Program for Palliative Care and continues to champion early integrated compassionate care across the nation. Please join me in welcoming the President of the Indian Association of Palliative Care, Dr. Geeta Joshi.
Namaste, dignitaries on the dais, senior members of Indian Association of Palliative Care, invited guests and delegates. On the behalf of Indian Association of Palliative Care, it gives me great pleasure to extend my warm greetings to all of you on this auspicious occasion of 33rd Annual International Conference of Indian Association of Palliative Care, which is jointly organized by the Sparsh Hospice and Basavatarakam Indo-American Cancer Hospital and Research Institute. At the outset, I sincerely congratulate the organizers for meticulous planning of this conference. The scientific program reflects an excellent blend of academics, innovation and technology, and thoughtfully designed with the sensitivity towards the concept of safe environment. Such a well-planned event is possible only through the teamwork. And I deeply appreciate the dedicated efforts of the entire team under the leadership of Dr. Subramaniam, Dr. Pradith and Dr. Raju and many others who have joined this venture. Indian Association of Palliative Care is an organization with a legacy of more than 3 decades. And since its inception, IAPC has remained committed to promoting palliative care through education, awareness, training, advocacy and service development. Organizing IAPCON every year remains one of our core academic commitments. Alongside this, IAPC conducts many courses aimed to educate our multidisciplinary team members. But the final aim, ultimately, our collective mission is simple yet profound, that is to relieve suffering. And for this, I invite anyone who has a good, appropriate idea, actionable plan to align with this mission to contact me directly and to our secretariat. Young academicians to come forward and take lectures and education programs in our academic courses, and they can write to us with their CV and the subject of interest. I also invite present and past executive committee members and regional representatives to organize conferences, seminars in their states and region, and to the spread word of awareness and education in palliative care in each and every corner of India. I am confident that the thoughtfully curated scientific program of IAPCON 2026 will offer something meaningful to each one of you, and that you will return to your respective places enriched with new insights and innovative ideas to enhance your palliative care practice. I further wish you all a rewarding and enriching conference over the next 2 years. And again, congratulate the IAPCON team for a very successful, very well, meticulously planned event. Jai Hind.
Thank you very much, Dr. Geeta Joshi. Our next speaker is a distinguished pain management expert, anesthesiologist, and a researcher, a founder leader who has advanced cancer pain care through impactful publications, national guidelines, prestigious awards, and global clinical contributions. As the secretary of IAPC and professor in the Department of Anesthesiology at Tata Memorial Hospital, Mumbai, his work continues to shape the standards of compassionate, evidence-based care. So please put your hands together and help me welcome Dr. Raghu Thota.
Thank you. So let me correct that I am a professor in Department of Palliative Medicine, not anesthesiology. So I am proud to be a palliative physician. Respected dignitaries on the dais, esteemed faculty, dear colleagues and friends. So on behalf of the Indian Association of Palliative Care, it is my great honor to welcome you all for this wonderful IAPCON 2026 here in a beautiful city of Hyderabad. So this is not just a conference, right? It is just coming together of shared thoughts, values, compassion, commitments, and competence. For what? To relieve the suffering of our patient so that he can have a wonderful days which he has to have. So over the next few days, let us learn from one another. It is not that the learning is one way. Challenge our thinking, strengthen our collaborations, and most importantly, renew our purpose to place the dignity, comfort, and patient-centric or person-centric care at the heart of healthcare. So I thank the organizing committee, the faculties, the volunteers, and every delegate who has travelled far, near, and from far places to make this congress and this conference possible. So with the spirit of learning and togetherness, I formally welcome you all and wish IAPCON 2026 a meaningful and inspiring beginning. Thank you and have a wonderful conference.
Thank you very much, Doctor, for correcting us. And right now, it is indeed our privilege to welcome somebody very special, our chief guest, who has played a defining role in shaping medical education and public healthcare leadership in Telangana. From serving as Director of Medical Education to leading Government Medical College, Yadadri Bongir, and heading pediatric surgery at Nilafar Hospital, his journey reflects vision, academic excellence, and institutional transformation. Today, as Vice Chancellor of Kaloji Narayan Rao University of Health Sciences, he continues to influence the future of healthcare education and policy. Ladies and gentlemen, please help me welcome our chief guest, Dr. K. Ramesh Reddy. Thank you for being here, sir.
CEO of basavatarakam Hospital, Dr. Subramanian, the organizing chairperson, Dr. Geeta Joshi, the president of the Indian Association of Palliative Care, Dr. Raghu, who is the secretary of the Palliative Care, Dr. Planeet, Dr. Raju, and all the eminent faculty who have come here for this conference, the 33rd Indian Association of Palliative Care Conference, IAPCON 2026, and all the delegates. I'm really glad that the Sparsh Hospice, which is an innovative idea in Hyderabad, and the Basavatarakam Hospital, which is a leading hospital which is taking care of the cancer patients, have come together to organize this conference. Actually, we attend so many other conferences of various basic specialties, but I feel this particular conference is something different because as we know that various medical specialties, they have made a remarkable progress. Almost all the medical colleges, the corporate sector hospitals, everywhere we find these specialities and the departments. But this is one specialty, palliative care, which has to really pick up in India. Now, as we all know that palliative care, all of you are better judges than me, and it is the one who takes care of the terminally ill and the life-limiting illnesses, and that is where you come into play and give them the support, what is needed, along with the treatment. Now, as we know, when a person in the family who is really suffering with pain and with any of these ailments, then ultimately the family thinks about a facility where they can give palliative care to the near and dear ones. Some cannot afford, but the love and affection for the kith and kin is same, and some can afford also. The main problem is there are no adequate centers to cater to this particular requirement, which I think I'm really glad to see so many of you delegates here who are really involved in the palliative care. This is really heartening to see so many people, and I'm sure in the days to come, it will be within the reach of every individual who is in really need of palliative care. As we know, even the government of India and the state government is focusing on this particular field. I think it is apt to mention here that the state government has started palliative care centers in almost all our major hospitals which are attached to teaching hospitals, wherein we have even the geriatric care, even the cancer care centers. These are all the innovative ideas the state government has introduced in various teaching institutions and some of the major district hospitals. And this is where your real palliative care treatment comes into play. But what I personally feel is that a structured program is needed to train. They may not be all qualified palliative care specialists or even palliative care trained paramedics. But a structured program is very important, and that is what is needed for the proper evaluation and trained personnel to be available in nook and corner to treat the patients. This is very important, and this is possible only with this type of conferences, and at the same time, if the number of training centers increase in the medical colleges and in the corporate sector hospitals where they can provide DNB training. I think if you really look at the status of availability of training centers, there are only 21 postgraduate MD seats for palliative care in India, and none of them are in the South India. And when I was just going through the availability of seats, it is really heartening to know a place like Rajasthan has 10 seats, but not a single center from South India is having palliative training program. I think some of the hospitals, including the Basavatarakam hospital, has a DME program. So when I was just sitting and discussing with Dr. Subramaniam, I think if we are not able to start even the MD program, we can start the fellowship programs, and that's what this Spurshal has taken up. They have started the fellowship program, And from the university side, I think this should be the motive in other health universities also. They should start fellowship programs wherein a properly planned training program can be imparted to those who are interested in this particular specialty. So, at this juncture, I think there is one more point which comes to my mind is the availability of palliative care centers, not only in government, even the private, and associated hospice. I know many of these centers are not really lucrative or money spinning. So many enterprising people may not be coming forward. But ultimately here, there are only two sectors, that is, one is the government and the other one is the philanthropic attitude people who have to come forward and establish these centers. And at the same time, we have to propagate properly to the society also that palliative centers are not just those areas where they can leave their old incapacitated parents for them to be taken care of, because they are established with a specific purpose. This is what we see in the government hospitals. Wherever there is a palliative center,
Chief guest, Dr. Ramesh Reddy, my dear friend, Dr. Subramaniga, Dr. Joshi, Dr. Raghu, Dr. Rosgar, all the distinguished faculty who have taken the trouble of traveling distances to come here and educate us, and of course, most important, the delegates, ladies and gentlemen, good afternoon. At the outset, I'd like to really appreciate my friend here, Dr. Subramanian. He was one of the very early doctors who have actually relocated from England, having trained in advanced centers and brought this excellent anesthetic practices. So it's very well known for him. However, what is much more is that last 15 years, he brought this concept of palliative care, which was really literally non-existent at the time. And 15 years as a solo person, he fought, gathered various resources, and now stands a wonderful Sparsa Hospice Center. I think we should be very, very grateful, the entire Twin States, and of course the palliative community, Dr. Subramanian, and our friend Dr. Praneeth. In fact, we're so privileged to host you this wonderful conference here along with Sparsa Hospice. Ladies and gentlemen, I'm so honored to be in here. So honored because to meet you, to stand amongst you, I have such a highest regard for this particular specialty. Medicine is generally respected. In spite of being so much of commercial, we've been criticized for charging heavily. That's equal, but you are the real beacon of hope. You are the one really upholding all this wonderful service value. So the entire medical fraternity should be very grateful to you for that. I know there isn't much monetary benefit compared to other specialties in here, but still you chose this specialty. When that patient comes to the end of the road state, where there is no scope for cure, and you hold his hands, and you hold the family hands, and you give him this hope with your kind words, your compassionate words, that soft touch, no matter how much the technology developed, no matter what the machines, whatever, at the end of the day, that nice, soothing, comfortable touch and few reassuring words is the one that makes the difference. So I must have the highest regard for this particular field of medicine. Please continue to do that, and you'll come here from different parts of the country and with interaction with so many pioneers here, and I'm sure all this interaction would definitely help for you to serve better, more patients. So Basavatarakam Hospital indeed, so glad and really privileged to join hands with Sparsa to host this conference. And our chairman, as you just heard, unfortunately could not be here. So I could come and enjoy all this honor. Now, it is a team effort. We had the privilege of having a department there, a well-established department with dedicated multidisciplinary professionals. We have anesthetists who are specialized in this field of medicine. We have social workers, we have physiotherapists and psychologists. So this is indeed, I realize it's so important. And also our specialists are involved well in the early part of the care rather than just taking care of the dying patient. So I think that's equally important that you are involved much earlier, and I'm sure that's going to influence dopamine of patient, that influence the betterment of the patient rather than coming right. And Dr. Ramesh Reddy just said, sir, it is so important that government has to involve in this, and it is such a wonderful care art, and you have to really establish and let people know. A conference like this, I'm sure, would go a long way to make more awareness amongst many public, and in particular the general public and medical professionals. So medical treatment is just not prolonging life, right? What is the point in prolonging life if you cannot give comfort and dignity? It doesn't make any sense, and that's what you're doing. Not just by merely, curing the, comforting the pain. There's a lot more in that mind, in that family. So that is equally important, and I believe that's what palliative care is all about. And dealing with those symptoms, with this, body riddled with metastasis or whatever you like, advanced stage in cancer. We see a lot of them. We have a 650-bedded tertiary care cancer center, and for your information, it's completely not-for-profit organization, and we have a policy not to refuse any patients. And quite frequently, many patients come to us late stage, refused by other hospitals, or all the resources are exhausted elsewhere and they come to us. And many people come to us to die. And that's why we have a very deep relationship with our hospice, and we work together in many occasions. So that quality of life, that gentle touch, that compassion is the one what we are.
This app has a dedicated section for this particular conference as well, ladies and gentlemen. Give it a big round of applause. It's going to be regularly updated. Thank you very much to our chief guest and our guest of honor for doing the honors. It's going to be regularly updated with all the relevant details, and the app ensures seamless access to schedules, sessions and information anytime, anywhere. So smarter, greener, connected, that is the buzzword here.
Okay, I'll go on to another story now. We wait for the presentation. When Dr. Geeta Joshi took over in last Feb 2025, she requested me to help her out. We plan lots of innovative things. Many things will come forward in next 2 years. But the first thing I told her, that is time has come. IAPC has come up the age. IAPC is not a child. IAPC is 3 decades old, and it is time that we start acknowledging our past presidents and a lot of people who have helped the IAPC to come forward. And that is how, out of 13 SOPs, standard operating procedures, the first SOP I wrote on award of IAPC oration. That came up almost in end February. And that is how this particular thing, we wanted 2 awards to come up. One was the Visionary Award, for those people who founded the IAPC way back in 1994. And second, we wanted annual oration award that we had planned to give it to the past masters of the IAPC. Dr. M.T. Bhatia, Visionary Award. What is a visionary? I mean, I can see you here, I can see that particular curtain. But visionaries are those people, they say beyond. To quote Dalai Lama, I think that was given by Dr. Nandini, it's a deeper resilience. When they started the idea of palliative care in India, nobody knew about it. But three people they got together. Dr. Keshav Pandey, Dr. Akram Lal, and Dr. M.T. Bhatia. And they said that we must do something, and that is how IAPC was founded in Ahmedabad way back in 1994, and that is what I was saying, visionary award, isn't it? It's someone with a strong vision of the future, often characterized by unusual keen foresight and the ability to think about or plan the future with great imagination and intelligence. It's a deeper resilience. There was no chance of palliative care coming up, but their hard work made the impossible thing possible, and we are not only 30 years old, but our medicinal stream has been already acknowledged by National Medical Commission, and lots of MDs in palliative medicines have come up. Dr. M.T. Bhatia, advent of palliative care. In 1984, he took study leave, went to UK for 1 year and studied pain management and palliative care. He visited St. Christopher's Hospice, met Dame Cecily Saunders, got inspiration from her to open a hospice. I just want to tell you, he took 3 jumps. He was an anesthesiologist. From there he went over to the pain management, and then thereafter the final jump was palliative care. After going over there, meeting Saunders, he established before that, during pain management, he conducted ICMR projects. He was a pain specialist.
On behalf of Dr. M.T. Bhatia, being collected by Dr. Bhavna Patel, his student. We'd like to thank Colonel Yashwant Joshi for speaking so beautifully about Dr. M.T. Bhatia on this amazing occasion.
Running short on time, so thank you again for making this program grand successful. Coming here. Thank you.
Thank you very much.
నా పేరు డాక్టర్ సుబ్రహ్మణ్యం, నా కొలీగ్ డాక్టర్ రాజు. మేమిద్దరము స్పర్శ్ హాస్పిస్ అనే సంస్థలో పనిచేస్తాము. నేను ట్రస్టీగా, ఆయన డాక్టర్గా. స్పర్శ్ హాస్పిస్ ఏంటంటే పేషెంట్స్ హూ హ్యావ్ నో ట్రీట్మెంట్ ఆప్షన్స్, వీళ్ళకి ఎండ్ ఆఫ్ లైఫ్ కేర్ సపోర్ట్ ఇస్తుంది. సో ఈ బ్రాంచ్ ఆఫ్ మెడిసిన్ ని పాలియేటివ్ కేర్ అంటారు. సో ఒక వ్యాధి చనిపోతున్నాడు, వాళ్ళకి ఏం చేయలేం మనం, కానీ ఉపశమనం ఇచ్చి వాళ్ళకి ఎండ్ పీస్ఫుల్ ఉండేటట్టు చూడాలి. ఇప్పుడు ఇలాంటి స్పెషలిస్ట్ దేశమంతా నుంచి వచ్చారు. ఈ పాలియేటివ్ కేర్ కాన్ఫరెన్స్ ఒకటి మేము బసవతారకం హాస్పిటల్ కలిసి హోస్ట్ చేస్తున్నాము. కాన్ఫరెన్స్ గురించి డాక్టర్ రాజు గారు చెప్తారు.
నమస్తే. ఈ రోజు మేము 33rd యాన్యువల్ ఇంటర్నేషనల్ కాన్ఫరెన్స్ ఇన్ పాలియేటివ్ కేర్ జరుపుతున్నాం హైదరాబాద్ సిటీలో. ఇది ప్రతి సంవత్సరం ఒక్కొక్క సిటీలో జరుగుద్ది. ఈ సంవత్సరం ఐఏపీసీతో కలిపి పాలియేటివ్ కేర్ కాన్ఫరెన్స్ హైదరాబాద్ లో చేస్తున్నాం. సో ఈ కాన్ఫరెన్స్ ద్వారా పేషెంట్స్ ఒక ట్రీట్మెంట్ లేనప్పుడు ఇబ్బందులు లేకుండా ఎలాగ ఉండాలి, సో రీసెంట్ అడ్వాన్సెస్ గత సంవత్సరంలో 2 సంవత్సరాల క్రితంలో ట్రీట్మెంట్ వైద్యం ఎలాగ అడ్వాన్స్ అయిందో, సో హౌ కేర్ హ్యాస్ ఇవాల్వ్డ్, సో ఇవన్నిటి గురించి ఈ కాన్ఫరెన్స్ లో వచ్చే నెక్స్ట్ 3 days హైదరాబాద్ కి ఒక 650 మంది ఇతర స్టేట్స్ నుంచి కానీ ఇతర దేశాల నుంచి కానీ వచ్చి ఈ కాన్ఫరెన్స్ లో పార్టిసిపేట్ చేయడం జరుగుతుంది. సో ఆ ఇంటెంట్ తో మేము on behalf of Sparsh Hospice and Indo-American Cancer Hospital, we are organizing this conference. It is a 33rd annual international congress. We call it as IAPCON 2026, which is being held at National Institute of Micro, Small and Medium Enterprises, Hyderabad. Thank you.
ఈ కార్యక్రమానికి బాలకృష్ణ గారు రావాల్సిందిగా సార్.
ఇండో అమెరికన్ చైర్మన్ గా basavatarakam చైర్మన్ గా బాలకృష్ణ గారు రావాల్సి ఉంది. కొన్ని అన్యాన్య కారణాల వల్ల రాలేకపోతున్నారు.